So today I want to talk about New World screwworm and really want to focus on is what we need to know in Canada, what the threats are to animals and what the veterinary profession has to do to be aware of this and to contain the problem. The good news is this is not likely to be a big problem for us. This is something that we're going to see with sporadic cases potentially linked to imported animals, but we have to be aware because of the potentially significant animal and human health risks. So this is our critter on the top right there. This is the New World screwworm. I won't try to pronounce his name. I'll leave it up there for you. This is a really important and devastating cause of fly strike or myiasis. It's a parasite that was present throughout North and South America and was gradually eradicated in North America. Still endemic in South America. I'll show some graphs later on about why that's the case and why we're really not going to get rid of it in South America. We've been able to control it in North America. We're seeing some counters to that, which is why we're discussing this today. But this is not a fly that can be eradicated across its endemic range. So something we're going to have to deal with regardless. But as this becomes more of a problem in Central America and moving up towards the US, the threats to us get greater just because of animal movement from those areas. So it's considered a re-emerging disease in North America because it was quite successfully eradicated and controlled, and now we're seeing a resurgence. It has a lot of impacts on animal health. It can have a lot of impacts on human health. It can have massive economic impacts in endemic areas on livestock. And because of that, you can see three main UN agencies, FAO, World Health Organization, and WOA, the animal equivalent, have all declared this a priority disease for eradication, realizing we can't eradicate it everywhere, but there are some places that we can. So this is a bit of an ugly slide, but this is the basic life cycle. So we have the adult female screwworm. She's attracted to a wound. It doesn't have to be a necrotic wound, doesn't have to be damaged tissue. She can lay eggs on any compromised skin barrier. So any type of laceration, trauma, wound, cut, that creates the opportunity for the female to lay eggs. Those eggs can be laid fairly quickly in large numbers, and they hatch, and we get larvae and maggot development. Those feed off the animal or person, causing potentially quite significant damage, and then they fall off and they finish their maturation in the soil. So the adult fly emerges from the soil. So important things here is, animals are the source of the maggots, the larvae. They're not themselves directly infectious because there's an environmental step. So that's important for us to think about in terms of control and what we have to do to prevent transmission when we have an infested animal. Females can lay a lot of eggs, and when you have a lot of eggs, you have a lot of larvae, you have a lot of maggots, you can have a lot of damage. And they can also travel large distances. Some insects don't travel very far. This is one that can. Adults can fly 4 to 20 kilometers in tropical climates with high host density. So when you've got really good conditions and you've got a lot of hosts, they will still travel a fairly long distance. When you have poor conditions, they'll travel even farther. And it's been talked about up to 300 kilometers in less than 2 weeks when the conditions aren't favorable, when they need to go searching for a better climate or more hosts. So this shows how we can see emergence and spread of this thing fairly rapidly if it can move that far in search of an appropriate climate and in search of appropriate hosts. So again, we're back to the adult fly. That's what it looks like, slightly bigger than our typical house fly. You can see the big orange eyes. It's got a metallic blue green body and some stripes on its back. They're easy keys to identify this if we ran into one. The maggots are, well, they're maggots, right? I guess for me, from a clinical standpoint, I look at them and say, gross, it's a magnet. They're a maggot. There are ways to identify them based on the morphology, and that's what's going to be used if we suspect a case, submitting that to get identified. But from a clinical standpoint, we're going to recognize this as finding maggots in an animal and then linking it to importation or contact with an imported infected animal. That's how we would be concerned about this disease. So why do we care? I've mentioned this a few times. It is a high consequence disease. We can have significant animal morbidity, significant mortality. These pictures, I think, show that really nicely. We've got a massive lesion on the top right. We've got this draining problematic lesion on the horse on the left. It's a pretty nasty infection around the eye. And then the one on the right, it's just a big mess of maggots and damaged tissue and kind of what I typically think of when I think of fly strike in the cases that I saw in practice. So these can be high consequence for the animal, obviously. For food animals, there can be deaths, there can be production losses. And these are pictures of animals, but we're animals too. This fly is attracted to any warm-blooded individual, so mammals and birds. And we're part of that mammal group. So the same thing, if we get a lesion, fly lands on it, lays eggs, we could have the same types of problems. Now, the good news for us in Canada is weather, right? We don't really like winter sometimes, but it helps us out with various infectious diseases and parasites, and this is one of them. The larvae are very cold intolerant. They'll die at 46-ish Fahrenheit. So basically, once it starts getting colder, they're not going to do as well, and they're ultimately going to die. So the good thing about us, even with climate change, which is absolutely real and is absolutely a threat for various diseases, we're a long way off from creating endemic areas where we're going to have year-round transmission, places where it doesn't drop below, 7 or 8 degrees Celsius. So cold is our friend with this disease. So, and that's really important for us because it doesn't mean we can't get it up here, but it means we shouldn't see or we can't see long-term transmission over seasons. We can get an infection, we get an infestation, we could potentially get a couple generations of transmission during the warm weather, but ultimately, our cold weather is going to catch up with this parasite and stop things. So I mentioned eradication. So historically, there was significant effort to eradicate this, largely through the use of sterile fly release. And I'll come back to that later. And you can see this map starting with the US and working its way down from the 50s and 60s in the US down to 2001 in Panama. So gradually working its way down by narrowing the endemic areas, addressing it with aggressive, mainly sterile fly control, and highly successful. Financially, I'm not going to go over all these numbers. It's a big deal, is the point I get across. And I'll show you another one for Texas, how it is a really big deal. Like this isn't the odd animal that gets a really gross lesion and it ends up dying or euthanized or fixed. This is something that has substantial impact on morbidity and production. If you look at the top there, 5 to 10 million per year in producer losses. That's in 1930s and 1940s dollars. With the eradication efforts in the 90s that continued and worked their way down Central America, it was estimated the benefits in the billions of dollars per year. So this is a high consequence disease economically, let alone the animal health impacts. So saw that graph before where the serial eradication over time from the late 50s in the US down to 2001 in Panama. And unfortunately, things turned around in, well, the last 5 years, last 3 years, really. The problem is this is endemic in South America and it's not eradicable in South America. I'll show a graph or a map of why that's the issue. So there's going to be continued threat of resurgence from South America. And if your control measures break down, at the areas close to South America, we're going to see reintroduction. And that's what's happened, right? As control measures break down because of cost, because of complacency, whatever it is, decreasing effectiveness of measures. There could be a lot of reasons why it reemerges, but it starts to sneak its way back up. And you can see that it didn't take long. We're looking August 22 in Panama to November 24 in Mexico. That's a pretty big distance for this to move. And you can see I mentioned before, 300 kilometers over 2 weeks, a fly can move if it's searching for a good environment. That just shows how quickly things can change. It's getting fairly close to the US border now, and that's a significant concern down there. The other thing I want to highlight is the Caribbean. This is endemic in various islands there, Cuba, Jamaica, Dominican Republic, Haiti. And this is a big issue for dogs. We import historically fairly large numbers of dogs from the Caribbean and we're importing from endemic regions, there's a risk of importing infected dogs. Now, I mentioned this before, so we're looking at suitability. So this is important for us for perspective. So to realize where we are, where we're not in terms of the likelihood this is going to emerge, and also to put some of the control measures into context, just so we understand what's going on. Actually, if we jump to the one on the right, that shows us the problem because South America is really red. Red is high suitability. Like a lot of the continent is suitable. A lot of areas that are going to be hard to access. You can't go in and, release sterile flies throughout a whole continent. You can't do that throughout the whole Amazon. There are so many flies, there are so many wild animals that are potential sources of it, reservoirs for it, that we're not going to eradicate it. You can eradicate it in zones where you don't have as much risk and when you can really address that. So getting up into the northern extent of South America where you're bridging on Panama is the place you can maybe control it. We're never going to eradicate it in South America. So we're going to always have this risk in animals imported from there, and we're going to have the risk of it sneaking back in. Now, if we look on the graph on the right, you see that there's a lot less red. And especially once you start getting into Mexico, it's a, relatively narrow corridor in broad geographic terms, relatively narrow corridor of high suitability. So you can see how it's worked its way up. This is this fairly continuous area of red or close to red heading into Mexico. And then you can see the South US, like Texas has some areas that are high concern. Florida has some issues that are because they're really, really suitable. In Florida, there was an outbreak of this in deer in 2017, I think it was, that was eradicated through a pretty concerted effort with sterile fly release. So the US does have significant concerns because we have this contiguous pathway up to them. We've seen the movement getting close to them. We have, some highly suitable areas. The good thing is the corridors aren't huge. So if this is coming up through all of Mexico, there's a lot more of the US to have to address than if it's coming up this more narrow area on the east side of Mexico into, southeast Texas. But, the way it's marching, the US does have significant concerns for that. So I mentioned the human side. I'll focus on the animal side, but this is a significant human health concern too, because it's a fairly, nasty disease potentially. This is a case from last month, reported infection in a person. It wasn't a very severe one, I think, but this is a person that just got an injury. They were in, they had, they changed where they thought the person got from. I think El Salvador was the final word. Somewhere in Central America, they acquired this and brought it home. This is a Canadian one that kind of went under the radar. This was earlier this year. 80-ish-year-old Canadian just had a fall, just stumbled and fell while in Costa Rica and developed some abrasions on knees and shins. So nothing really remarkable, just a fairly straightforward skin lesion from falling and developed an ulcer. You can see on the picture there about a week after the fall. And this was New World's screwworm infection. It was identified back in Canada from a traveler. It's going to be an analogous situation would be us getting this in an imported dog or a traveling dog. We don't see as many people traveling with their dogs to Central America and coming back, but it does happen. If it emerged more in Texas and Florida, then we'd have significant concerns about people, snowbirds traveling with their dogs and then coming back. This is just a comment from that paper, and I think it relates to us very well. Clinicians should maintain a high index of suspicion for New World screwworm infection in travelers returning from Costa Rica and nearby regions who prevent with myiasis. So for us, we should be aware of this in any animal that comes back with maggots or a lesion where maybe that's going on down deeper. Prompt identification, thorough removal, and secure containment of larvae is critical. I'll come to the management side. So a little bit of awareness is key. It is often a fairly obvious infection, but it doesn't always have to be. Transmission. So I mentioned this before. Affected animals aren't directly infectious. The maggots drop off and they pupate in the soil before they can become adults. So we have to be concerned about the environmental contamination aspect. Addressing the animal is one thing, but since animals can seed the environment, that's how we get into at least a couple generations of transmission. So for us in Canada, we're not going to see endemicity because of the temperature issue. But if we had an infection, especially early in the summer, you get an animal that's infected, the maggots drop off, you get more flies, it's still nice and warm. We can get, short-term, multiple generation transmission until either it burns out or the weather kills it off. Theoretically, I guess inside a barn where the temperature is more temperate, even in colder weather, we might sustain it for a little bit, but it's going to be harder to sustain this in a barn where you can see infections are happening. We can control it a lot more. So realistically, from a maggots falling off and flies coming out and sustained transmission standpoint, we're worried about a few generations of this happening during the summer, and then it resets in the winter once it gets killed off. Warm, humid conditions are preferred. They don't like dry and hot. And like I've said a bunch of times, they don't like it cold. Infestations, it's fly strike, right? It's pretty straightforward. We got lacerations, wounds, anything that breaks the skin barrier creates an opportunity for an infection. Routine wounds just from an animal being outside, surgical procedures, dehorning and branding has been implicated in livestock. Newborns, the umbilicus is a potential source anywhere where we just don't have a nice skin barrier. So umbilicus was there. Post-parturient animals where you may have, you got fresh blood, you're attracting flies to those areas. And again, this isn't a fly that needs necrotic tissue. It can infect healthy but damaged tissue. Even minor skin damage. It's been mentioned that tick bites can be enough, just that little bit of a skin lesion to give the fly the ability to deposit some eggs. Diagnosis, well, diagnosis of fly strike in general is pretty straightforward. You're going to see maggots. Sometimes these are very obvious. Sometimes they're like that person where you've got that ulcer where you may have a small number in there. They're not as obvious because they're in deeper tissues. You may have situations where you've got something within a nose, within an ear canal, deeper within an umbilicus that you can't see outright. So it's not necessarily one you're going to look at and think this classic maggots everywhere on the back of the animal. So we have to investigate a little bit more when we have a higher risk situation. So understanding the risk is really key. Like if this is an animal that's never left the country and we don't know of any New World screwworm in Canada, the odds of it having that are exceptionally low. If we know the animal has come back or been imported from an endemic area, then it should be on our list. So identification of larvae is the key. So collect the larvae, put them in a container with alcohol or formalin. Just alcohol is a little nicer to handle, and then we can send that off for identification. And there are specific ways they're going to look at it based on the characteristics, the morphology of the larvae. So like I said before, some of these infections are pretty obvious. Some are really big. They're large or they're ulcerated, they've got maggots on it. It's a pretty easy call that at least there's fly strike. But I said before, not all are obvious. You might have ones that have an infection inside the nose. So you might have nasal discharge, odor. We think more of a necrotic smell as the damage is happening. But anything that's got nasal discharge, ocular discharge in a recently imported animal, I would want to make sure that we're taking a good look. Ears, we should be looking anyway. Nose, if we've got this discharge from a recently imported animal, especially if it's kind of necrotic smelling and we think there's some damage being done in there, I would want to get a look in there if at all possible. Wounds that deepen despite wound care, short-term chronic ulcers. Like we're not assuming it's causing this disease for months and months because the life cycle is fairly short for the maggots, but something that, you've got this ulcerative lesion and it's persisting for a few days, getting a look down in deeper would be useful. Um, yeah, and you could say non-specific signs of disease with any external lesion if you have a deeper infection. It's going to be pretty unlikely, but if you've got a wound on an animal and it seems like you've got deeper involvement, you've got a lot of cellulitis there, you've got drainage, something will look maybe like a foreign body, more than just your routine discharging wounds. If it's from an endemic area, I would want to have this on the list. Picture at the top right, I guess if we said this type of infection, this is probably what I would start thinking about. These big ones. I remember the first maggot infested animal I saw in general practice was a lamb, and then I touched its back and lifted up the skin, and there were hundreds of maggots under there. So some of them are quite obvious like this. The bottom one is a little more subtle, right? We've got this nasty ulcer, but we don't see maggots everywhere. You have to go looking around a little bit for it. So treatment, it's pretty straightforward. We need to get the maggots out, may need to clean and debride any damage that's been done, might need to treat a secondary bacterial infection. So all this comes back to maggot removal and good general wound care. And what we don't want to do is just take the maggots out and chuck them on the ground, which I think probably would be my first response on this. But if we're doing that, we're just giving them a ride, right? We're sending them where they want to go, which is in the environment. So careful removal of eggs and larvae, putting them in alcohol, which will kill them. And if we need to submit them, we've got them in there. Again, try not to get them off the ground. If you see maggots on the ground where the animal, you've been handling it before you start trying to treat it, pick those up, put them in alcohol as well. Beyond that, general wound care. Some of these are going to need fairly substantial wound care. If you have these big lesions, it's going to take a long time. Like I said, might need secondary treatment of secondary bacterial infections along with that. Antiparasitics do have a role here. They don't have a role as the sole treatment. We have to physically remove the maggots. You can kill them with antiparasitics, but we want to get them out as quick as possible. Really, what antiparasitics are for is to kill any missed larvae or deeper larvae that we can't get at. They're just an adjunct treatment. We don't have any approved drugs. Doesn't mean we don't have anything we can use, but we don't have approved drugs. This is from USDA, and I can't see the top based on the bar I've got here, but it's interesting wording. It's like, yeah, information veterinarians might find useful for making extra label decisions. Basically, it's saying here's some things you could use, but we can't say to use them because they're extra label. So we do have a variety of drugs that should be effective, and this could be for prevention or it could be for treatment. Again, not what we're going to rely on. The other thing to remember is when you've got a really advanced infestation, you've got a lot of necrotic tissue, your maggots may not be able to ingest much of that antiparasitic that's being used systemically. So again, we don't want to use this primarily, but there may be some rules. Doramectin, ivermectin, Nitropyram, the one we have for dogs and cats in Canada, various other ones that we widely use in some of our, especially our domestic dogs and cats. So there are some options there, and we're going to use them secondarily. So in terms of therapy, ivermectin is the most commonly used one. It's not really because it's any better. I think it's just because it's tried and true, and it's most accessible in areas where this is more common. Um, it's extra label for treatment and prevention, but as you can see, USDA says, you can kind of use this. Standard dosing. It's been shown to protect a single dose will protect cattle for 12 to, or sorry, 14 to 20 days. Doramectin, kind of similar, single dose, 21 to 35 days. Nitropyram, don't really have duration information on that, but it seems to be quite effective for killing and expelling larvae at the time. So with an infestation, if we use that, we can help speed up elimination of the larvae. And like I said, that's one that's licensed for use in dogs and cats. Um, Insecticides also have a role here to handle the environment. So we've got an animal, we're going to assume that some maggots have dropped off and are in the environment, so we'd like to treat that. The challenge with these is obviously toxicity, permethrins in cats in particular. So there are environmental concerns about using these. So it's a cost benefit assessment. What's the risk based on the time of year? Based on the area, the likelihood maggots have dropped off, the likelihood of toxicity in animals in the area, and what we can find locally. But to address the environment, spraying, housing areas, bedding, other types of materials, and then rinse them to get rid of the residues. Something else that gets done when you've had a case sometimes is fly paper traps. So we've got a case, we can put traps up to see if any adult flies are around. Just gives us an idea whether we have an ongoing risk. So if we see adult flies there, if we see one, they're probably more around, which means we definitely have to be aware that there could be more cases coming. So this is back to the life cycle, different one than, but the same idea as what I've showed before. So we get the adult flies, they mate, she makes eggs, deposits them on a wound, the larvae grow, drop into the soil, and become adults. So we do have multiple places where we can think about intervening. I mentioned before the sterile fly production, so we can prevent the production of viable eggs. We can deal with wounds to reduce the ability of flies to be able to deposit on there. We can kill larvae within wounds. And I didn't put the star here, but we can also address the environment. So we do have multimodal approaches to prevention of disease from a broader population control standpoint. It's sterile flies, though. So for prevention, and this would be animals that are in or visiting endemic regions, really we're focusing on prevention of wounds, wound care, bandaging open wounds, and observation. So I mentioned before that ivermectin, you can get the sustained 14 to 20 whatever days activity with ivermectin in cattle. Just be aware, we start thinking about using similar drugs in dogs and cats for heartworm prophylaxis, we're using much, much lower doses. So we can't extrapolate a heartworm medication, the protection we get from that, from a much higher dose that's used in cattle for early therapy and prophylaxis. Prophylactic feed through ivermectin has been mentioned in cattle. I've got a slide later on where the cattle producers in the US have asked for permission to do this. This gets into a variety of discussions about how much ivermectin do we want going into cattle, how much residue do we want in the environment, are we risking problems with other parasites? When you start using feed through, you start getting into more concerns. The long-term ingestion of ivermectin, it certainly has some selling points in the high-risk areas, right where this is starting to emerge in Texas as a broader strategy across the U.S. probably is not very useful. I'm just going to mention the U.S. situation. It puts some context into why I'm going to talk about U.S. control. And really, we're watching the U.S. because what happens in the U.S. can impact us from importing animals. We're not worried about like some diseases. Again, this disease coming up and establishing itself in here from the U.S. We're worried about it becoming a problem in the U.S. and then us seeing sporadic imported cases. So ultimate eradication was 1966. Around that time, they still had occasional imported case because while they eradicated it from the US, it was still fairly close in Mexico as it worked its way down. I mentioned that deer-associated outbreak in 16 and 17, that was eradicated again. They don't have any current cases, but they're obviously looking for it fairly closely, and it is getting close to the US border in Mexico. Again, for the scope, this is just Texas. So if you want to jump to the chase, that bottom 1.8, that's 1.8 billion with a B, potential impact in 2020. So if you look at death losses, you look at losses due to need to treat, need to manage the animals, everything that comes around with it. And there's going to be a PR component too, right? Every time we see a disease that's a high profile in a food animal, you get some concerns by the public, even though there's no risk from the food. So it's always tough to say how accurate these assessments are. But when they extrapolate 1976 things to 2024, think about what could happen in a reasonable case situation, it's a very substantial potential economic impact. So USDA response, they've geared up sterile fly production. They've got at least one facility ready to come online. I think there might be another one that I've read about. So being able to produce massive numbers of sterile flies, and you have to produce millions upon millions of sterile flies. So sterile fly production still is the cornerstone of eradication. They have brought in some periodic controls of importation of cattle from Mexico, just not wanting to cede the local environment and audit of importation controls. Obviously, it's a highly political situation when you're looking at issues with US and Mexico along the border. Fly trapping along the southern border just to see if there's evidence of adults in the area. They mentioned this is what the USDA said, and here's what we're doing kind of page. Increased efforts to intercept and treat stray and illegally introduced livestock. So I don't know if that's smuggled livestock or whether they're worried about other animals, but we have to remember that any warm-blooded animal can be affected. So all livestock are ultimately what they're concerned about from an economic standpoint. Any wild animal, mammal or bird that can get across the border could bring this in. So you can focus on cattle to help reduce the economic impact in cattle. But because we have so many other potential hosts, that doing everything with cattle or completely protecting cattle is not going to protect the US completely because of the other animals that can bring it in. And they're also putting more money into researching other approaches, including new fly strains, treatments, baits, lures, and ideally multimodal therapies for anything like this. You know, sterile flies have been highly effective, but we maybe don't want to rely just on this. So this has had a lot of traction. You know, we've had a lot of issues with the US not being proactive with things when it comes to infectious disease, but the US is quite motivated because of the livestock issue, probably. There is a significant economic driver and it's a significant political driver when we're dealing with livestock issues. So they have been quite, quite aggressive with their response to this. FDA has been looking at emergency authorizations for drugs. So basically, FDA is saying that they'll facilitate the process to bring in drugs that are effective against screwworm. They haven't really said what they're talking about there, but they're sending the message that they will facilitate treatment options should they be available and should they be required. And I went over this before, but the request from the beef industry to allow ivermectin feed through to prevent asphyxiation. So instead of periodic injection, oral in-feed ivermectin, which brings in a couple different concerns, but a couple different benefits. So what are we doing here? It's not a whole lot. And that's not a knock against CFIA. It's just a matter of there's not a lot for us to do here. A lot of what we have to do is think about the limited number, but still a reasonably large number, but the limited scope of imported animals and how we would address them and watching what's going on in the US. So do we need a similar response? Well, no, we don't, because we don't have potential randomicity. You know, climate change is real. Climate change is substantial. A lot of climate has to change before it gets up here. If you look at that map, right, the suitable zones were really extreme southern US and along the Gulf of Mexico. It's gonna be a long time before we get suitable climates for this parasite to be able to survive long term. So we have potential local transmission until cold weather. So we can get into significant disease issues. If we introduce this early in the season, you could have a lot of infections going on within an area until cold weather gets rid of it. So this is why we want to control it. We can ultimately rely on the winter to help us, but a lot of damage can be done, and human risk could come in the interim. And then I mentioned before, maybe some risk of transmission within barns, microclimates during colder weather. But that's going to require a continued cycle where you have to get an infestation of an animal. They produce maggots that drop off, the flies come up, they infect again. So yeah, we could stretch the season out within a barn probably in some warmer barns. But we can control that a lot more at the barn level. And this is why we want to know if there's a case. So if we know there's a case, we want to manage it really well. We want to prevent the environmental contamination. We want to do really good surveillance of other animals to pick up early infestations so we don't get into that. And if we're picking up the early infestations or preventing them, then it's going to die out. Just from a regulatory standpoint, I'll just leave this up for Seth if you can read it. If you want to know what the status is in your region in terms of reportability. So we've got CFIA, and we also have separate reporting requirements for different provinces and territories. This is one of these things where we want to know because we want to make sure the case is being handled well. What would the response be to a case? I haven't seen anything clearly that says what CFIA or the provinces would do in response to a case. And I suspect it would be very situational, right? We're not going to have an over response. We're going to go in and cull everything. You want to go in and see, okay, what's going on? What are the risks? What are the risk mitigation measures? What can we do to protect humans and animals? So, Canadian considerations, I guess, dogs and cats, imported animals are concerned. We import a lot of animals, right? And we import a lot of animals from areas that are endemic. So, just being aware of that. And, one of the things that's always kind of surprising is we don't always know when we see an imported animal until later. We can see this new dog that's coming to the clinic, and sometimes they don't offer up, they just imported it from the Dominican or wherever. So we could probably do a better job in querying where'd you get the dog from? Because they got it from Kijiji or they got it from a puppy mill. That is relevant for what we think about in some disease things. But trying to understand origins of new patients. And then if we have an animal we know is from an endemic area, just being aware of that. And that may be something as simple as, the animal's from an endemic area, it just arrived yesterday. Okay, well, if you get any lesions, anything looks weird, we need to see them right away, just because we're within that window of time where we could have an infestation coming up. Not freaking the owners out, but trying to get the case in as quick as possible. So flagging these recently imported animals, looking for infected wounds, draining tracts, and we import animals that are already sick too. So it's quite plausible we would import an animal that had an infestation that wasn't really identified, apart from it had a wound or something that was weird. And they'll take care of that when they get it in Canada. I said this before, but oral and nasal discharges, so getting a good look in ears. Most ear infections are going to be routine ear infections, but if they're recently imported, I would rather make sure we do a good exam to make sure there are no maggots in there. Wound from an animal in an endemic area, so a fresher wound, just to get a really close look for larvae, look for eggs if it's really fresh. If it just looks weird, looks deeper, looks a bit unusual, more complicated, be quicker to surgical exploration, which may be useful for the wound anyway, but to make sure there aren't any maggots in there deep. If we have an animal that's infested, removal of larvae, like I said before, just standard wound care, and then we can look at different therapeutic options. So trying to help kill larvae that are there or expel them. And again, just a reminder that heartworm prophylaxis dosing of ivermectin and friends is quite low. So if we're looking at therapeutic use of those types of drugs, we have different dosing. So we'd be looking at 150 to 200 micrograms per kilogram, usually often the injectable ivermectin, and then continued just larvae wound management as per normal. Livestock should be less of a concern, right? We don't import that many animals from endemic areas, but we do some. And if this goes to the US, then that becomes our bigger concern. We've got the reportability component to be aware of, but again, just general awareness from recently imported animals, observation of recently imported animals, good wound care, and then we have to investigate the potential for transmission and environmental contamination if a case happens. So the issues really for us probably are much more relevant for companion animals than they are livestock, just based on animal movement patterns that we see. So like I said, it's probably a fairly quick run through it, but hopefully identify some of the Canadian issues we have. So it looks like we got a few questions, and I'll start going through the questions, but if you have more questions, jump in. If you have a question that I missed or I didn't explain very well, toss it in the chat. My email was also there. I'll put it in the chat too in case you want it and didn't see it. So I don't know if anyone wants to jump in with comments or coordinating the questions. Otherwise, I'll just start going through.
No, just go
Kind
ahead,
of
Scott.
enough. Oh, sorry, go ahead.
No, just go ahead, Scott. That's fine. Thanks.
I see kind of enough of a brand name be used as environmental disinfected. I think I just want to look at, I would assume so, based on the pyrite. There's a concentration listed in there. I would just take a look at it. That was a US list, so I wouldn't be worried as much about the brand names. I'd be worried about the active ingredients that are in there. What about dipping cattle? It's gonna be pretty low yield, I think, overall. If you're worried about, like, if you want to take something for prophylaxis, that's when the injectable drug gives you a longer duration of activity. So that would probably be more of it. It's kind of getting ready with sterile male flies in case they're needed. I wouldn't think so because we're so far away, right? It wouldn't make sense to put the millions of dollars into a sterile fly facility. And you could say, okay, well, if we get a case in June, it'd be nice to release sterile flies to make sure we don't get sustained transmission. But bang for a buck, that would be really hard to justify. We're better off trying to identify the index cases as soon as possible and making sure those get managed really well so we don't get much down the road. Ivermectin pour-on should be fine for livestock. Do they get it systemically, right? You're getting ivermectin into them one way or the other. How long is the life cycle? So it's fairly short. So I mentioned before, they're in the wound for a week or so. Temperature impacts that a little bit. They're in the soil for a week or so. You're looking at a few weeks, a couple weeks to a few weeks life cycle. So that's why I said we could get multiple generations of transmission within a season. So we import a dog, cow, whatever in June that's infested, maggots drop off it. That can happen a few different times until the weather gets cold. So we have this window where we can get transmission. So we shouldn't get widespread transmission, right? But you can have this local transmission that could cause problems. And that's why we want to identify the index cases and manage them so we don't end up with massive numbers of flies during that short period of time. Question about spay neuter clinics and bleeds. Yeah, it would definitely be an area to be away from. Oh, dogs and cats, moxicloprid. Should I try to use a later instead? I'm not sure what there's probably an autocorrect issue there. I think the big thing I would want to try to do is look at wound care. And these are tough, right? So if they're unhomed animals or they're quasi-homed animals, we're not going to be able to pay attention to the wounds very much. If they're a homed animal and they're kept inside, then wound care, covering them, keeping them away from flies is going to be effective. If they're outside, then that's going to be a potential. Oh, okay. Epoxylator. You've probably gotten there. I see the correction. I would. It's a drug that's potentially effective. If you look back at that table, it's on that. So it certainly wouldn't hurt. Yeah. How would the clinical signs for this compare to endemic nasal bots in sheep? There'll probably be some similarity, right? You're getting something that gets up in the nose and is causing destruction. I would think that this could cause a lot more destruction than a nasal bot. Depends how many eggs, how many larvae are in there. But there could be some overlap with clinical signs. I would suspect. And my disclaimer here is, we don't have it in Canada, so I haven't seen it. This is based on just what I know about infectious diseases and talking to people that manage these. I've never touched one myself, right? We don't have a lot of people in Canada that have done that. Specific labs in Canada to send larvae for identification. So first thing I would do if I had one here is I would call AHL, our diagnostic lab, and say, will they look at it? And they would get parasitologists involved with that. Because it's reportable, I think the first discussion you would have if you're really concerned about would be CFIA, and they would help us coordinate where we're going to send it, like any reportable disease, right? We're not going to wait until, if we've got an animal that's imported, we're not going to wait around trying to do the diagnostic testing before we tell CFIA. We should be telling them right at the start, and they may have the best advice on where to send the larvae. Are larvae visible in X-rays? Well, I wouldn't think the larvae would be, but damage might be. You see soft tissue damage. Ultrasound would be more effective. If we have a deep lesion, a draining lesion, we're not sure what's going on, then ultrasound just to characterize the lesion. Um, Theoretically, you could get an idea with there are larvae there with an ultrasound, depending on where it was. But X-ray is just going to localize it to soft tissue. Can the U.S. ramp up sterile fly production quick enough? It's hard to say, right? They're ramping this fairly effectively. A lot of money is going in quick enough, I think is a big question, right? It depends on how much it's moving up Mexico. So, ideally at the start, you don't have to release sterile flies over a wide area. Again, as it's coming up Mexico, it's really confined to the coast, the high risk areas. So you can flood that with your initial flies and keep really hitting that area hard and with less in the peripheral areas. So I think there's, reasonable confidence, but just takes a few to get through. So it's a highly effective measure. It's not a 100% effective measure at the population level. It should help keep things contained. Will individual cases occur? It's quite possible. If it's bordering in Mexico, um, you're going to see some things that'll break through that. Um, let's see if I assume this, if female flies develop during sterile male release, could that become ineffective? So I guess the question would be if females start mating with multiple male flies, will they eventually find a non-sterile male? You'd have to ask the entomologist. I know the assumption is they only mate once. Could that change? I guess. I don't, there's a selection pressure, I guess. There would be a selective advantage for females that had promiscuous behavior versus ones that didn't, considering how effective this has been. Gotta wonder if that's the case. There has been some suggestion that sterile fly release in Central America has been a little bit less effective, and that's one of the reasons. It's not clear if that's because they're just not producing as many flies, they're not sterilizing them as well, the flies are getting damaged during the sterilization process. But I guess one of the thoughts could be that if female flies change their behavior, it's really hard to change ingrained behavior like that. But interesting thought. I wouldn't say no. Um, Yeah, how likely would it be the sterile fly production can match the spread of infestation? Good question. Like, and this is why the U.S. is putting a lot of effort right now into getting their sterile fly production rolling and rolling heavily. It is, will the flies from Mexico get there before the sterile flies get there at the border? I don't think we know. Yeah, I really can't say much more than that. Let's see. Yeah, comment from Mo, you might see them ultrasound. I think it probably said that versus X-ray. If I've missed questions or people, and if you have comments too, I know some people that will know what they're talking about here, feel free to jump in. I think I've maybe gotten through the comments. Let's leave it a sec, see if anyone else has anything. Oh, how would this look different? Oh, there's one with Cutiribra. I just lost it there. So it would look different than Cutiribra. So Cutiribra is I think a pretty obvious thing. You've got the breathing hole. You don't have that necrotic tissue. You've got the single lesion there. Other regular maggots is where, there's me similarity. Maggots are maggots. So if we're concerned, that's why we want to identify them. Like they do look different. Um, I'm not going to see an animal and see maggots on it and be able to say what it is. I would pull up some references online, try to get an idea. But if I had a travel history or if I knew there was any case in the area, I'd be sending it off to someone who knows better than me. So I think we have to be aware of it. If we have a maggot infestation, we have to be aware of the importation history of the animal and ideally other animals. If they just brought an animal up from the Dominican, a couple weeks ago, and now one of the housemates has maggot infestation, I would flag that as a potential one in case that index dog had a mild infestation that was missed, right? Um, Not very likely, but we don't see a lot of maggot infestations in dogs. So I think if you've got a potential link with an importation from an endemic area, I would rather err on the side of care. Yeah, USDA gave a presentation in August that gives a review of their sterile fly program. Thanks a lot, Susan. There's a link there. Yeah, USDA has put a lot of information about this. They are, like I said, being fairly aggressive on it. Um, CDC's done a little bit too in terms of presentations. There is good information out there. what measures we recommend to protect humans. So if we have a case in the area, so we identify it in dog, horse, whatever. My guidance for the people would be just to be aware that, this can affect other animals and it can affect you. If you have any skin lesions, cover them, clean them, cover them. And if you have any problems with them, go to your doctor and make sure your doctor knows there's potential for exposure because your doctor would not have this on the radar, right? Your average GP is not going to be thinking about this. So we want to make sure that people have that awareness, just like we do with a lot of zoonotic infections. We want to make people be able to advocate for themselves. So I think just the awareness that if you're in an area where you've had a positive animal, there may be some flies of concern. So we have to be careful with wounds and address infection in abnormal wounds with the consideration that it might be there. We might be,
Looks like we might have exhausted all the questions. Scott, if there's any final last questions, please do it. You've got to also have Scott's email address in the chat, and it's on screen there. So feel free to do it. I'm sure there'll be more on this. Scott in his go to his blog, and any updates, I'm sure Scott will be placing there as well.
yeah, and we've got a few people that know this parasite fairly well. And if anyone wants to jump in and comment or certainly willing for have some more ideas, but it sounds like we might be done. But yeah, if there are any comments as well, feel free to toss them in. Great.
Yep, looks like it's we're getting good comments there. So thanks, Scott, on behalf of the CVMA and those present today. We thank you, Scott, for taking the time to put together this presentation and for presenting it. Just for everyone, we will be putting it on the CVMA YouTube channel, so you'll be able to go back and look at that, or people that weren't able to be present today can go and then see it there. Well, it'll take a little while to get it up there, but it will be there eventually. Cool. Thank you very much, Scott. Appreciate it,
Great.
your
Thanks.
time.
Thanks, everyone.
And all right, have a good day, everyone. Talk to you again soon. Bye.